Okay, so you kind of flex here. Whew. And I found a really cool way to crack my back too, from doing this. When I'm down here like this, I'll pull here and I'll just kind of like hear that. Okay, so I got a pop like right in here, and then I'm gonna show you. I do it this way. I grab this arm, so it popped right there and right there, and I wish that I knew. If anyone knows how to pop the upper part of your spine, I cannot figure it out, but I know there's like a lot of times when it just gets so pressured there. I can tell like one part of my back adjusts and then the other part tightens up, and then I'll get like this really lots of popping here. Okay, so where have this evolved since I've worn the lift for like 8 months, and I can definitely say the pain in my lower back, which was chronic for at least, gosh, it was like 3 years, and it was progressively got worse and worse over that 3 years. Has moved. I still occasionally will feel it tighten up the way it used to, but it's not the same. Now it's kind of gone up to the upper part of my back, like up on this side. So the opposite side. So I had pain here, and now it's moved here. So it's kind of like this loosened up, and then the pain went to the kind of up, like adjacent upper part of my back. And of course, it cracks a lot there, so I'll get like cracking here and here, and then sometimes it'll switch around. There was times also where the pain, and when I started wearing the leg lift, the pain would go from like the bottom of my SI joint to the bottom of my ribs, and would kind of like go back and forth. It would go from like here to here, so it would tighten up here, and then I would feel pain here, and then it would go here, and then here, and then all of a sudden it would like boom, it would start hurting in my back, and then it would start hurting on the other side, and then it would go away for like 3 weeks, and then it would kind of work around back here, pain would go away, and then it would come back and kind of like go in this circular thing. And so the osteopath, he would always kind of say, well, this is it sounds like it's getting better, this is like old stuff. He'd always use the term old stuff. So where has this evolved to today? Okay, so today the pain is no longer so much in my back. It's gone up into my shoulders, and sometimes my hands will go numb. But I thought that's kind of had a lot to do with typing and a bad posture in typing, so I corrected my typing posture, and I can't say that it went better, but it got a little bit better, but I still feel my hands kind of getting numb sometimes. So I have these huge knots right here and right here. They're really huge. And I have like a lot of knots here next to my spine. So it's like here next to my spine, here, and then in my neck, mostly on this side. And it kind of seems like my neck gets strained a lot when I'm sleeping. I'll often sleep flat on my back, and I'll wake up and I'll have just like this, just like kind of like sharp pain in my neck where it's just like so strained. So I just my bias is probably that this is old stuff. This is part of it getting better, but hopefully, um, hopefully that gets better. And I hope if people have any questions that they'll ask me, because I've really kind of just thrown a lot of information out there, and I could talk for hours on this, but I would need people to like ask the right questions to get the information out, because there's been so many developments to this, and it was hell figuring out how to get to an osteopath. If anyone has problems, I suggest that they, one, educate yourself first of all. Start reading osteopath books, because I think they're superior to anything you'll find in physical therapy and chiropractor, but I think if you get the right language, you'll figure out who can help you. And so I would definitely make sure that you find out if you have a leg length difference. I think that's a huge component to any back problem. Educate yourself. And I don't really know what to say much about the relationship of body to mind and how you think about things and how this affects your back. But if you have anxiety and you know you have anxiety, it's probably the result. But there probably is a correlation. Yet, if it's unconscious, there's not really, it's kind of hard to really deal with unconscious anxiety. So in that case, if you are experiencing back pain and it's possible that it's unconscious, you don't really know how the mind relates to the body, what you can do is you can try, there's different medications for like anxiety. If you see a psychiatrist, they might be able to help you a little bit. And at least trying some pills for a little bit can help you see if it relates and helps, if getting rid of the anxiety, or if it helps the back, okay. And then the other thing was your posture. Your posture's got to be, it's got to be perfect. It really does. I noticed just recently, I mean, for the last 6 months, I've been doing a lot of typing in this chair, which is a hard chair, but I have this cushion on it. Well, I noticed after about like 6 months that I could only sit for a few hours before my legs would start going numb, my arm would start going numb. So I switched to a different chair, this chair right here, which is kind of a nice chair, but it's lower and it's more, it has like, it's firmer, but it has cushion, so it's just all around better. And I'll put, if you see, I have these pillows next to it, and these pillows kind of just help me keep my posture. I had a little I have this bag. Let me go run and grab it. I'm gonna let this run. I can't find it. But I have this kind of like, it's a waist bag. What do you call it? Like a fanny pack, except it has like, it's a backpack, so it's like somewhere in between a fanny pack and a backpack, but it has straps. And what I would do when I was in school, because it was hard, and a lot of these chairs at school, it's hard to keep the correct posture for if you have to sit for a few hours. So I would just kind of like, I would often wear like a sweater or something to school, but at school it warms up. I'd throw the sweater in the bag, and I would have this perfect cushion for my back. So in another video I could probably show that. And so but I hope, I know that the back problem has evolved. It's in the shoulders now and the neck, and so hopefully I'll keep getting better, and yeah, and hopefully this will help some people ask questions and help me get more of the information out. I used to be able to talk about this in terms of like the PSI, the SI, all kind of like the technical terms of, at least of your pelvis, but I don't read that stuff very much anymore. So anyways, hopefully this is helpful. Peace.